Hello everyone, I am Dr. Deepak Saha. I am a consultant cardiologist and in Medicover Hospital, Begumpet. Today I will discuss something about heart blockages, which is commonly used term whenever a patient is having a heart attack. Medical term for this heart blockages is either coronary artery disease or ischemic heart disease. But in a lay term voice, they understand heart blockages, which is basically when there are blocks in the artery supplied to the heart. So the coronary artery disease or the heart blockages happens in people who have certain risk factors. So what are the risk factors which leads to the blockages in the heart? There are some risk factors which cannot be modified, like the aging. So eventually all patients at certain age beyond 70 or 80, they will develop some blockages. And genetics, some people are genetically more prone for blockages, which are not modifiable. But then there are quite a modifiable risk factors which can prevent or at least delay the development of blockages, like diabetes. So if diabetes is there, definitely the chances of blockages are more. So once the blockages, if you control the diabetes well, the blockages will be reduced or there is a delay in the formation of the blockages. Similarly, hypertension. So if the blood pressure is well controlled, their chances of blockages are delayed subsequently. There are other risk factors like smoking or tobacco abuse. There are also patients having high cholesterol levels. Some patients who take unhealthy food habits, they are also at a higher risk for heart diseases or blockages. Then the lack of physical activity and obesity also leads to development of blockages. So how do we know whether the person is having blockages? A commonly used tests are normally a treadmill test, which is frequently done by people as annual checkups. So when the treadmill test shows some positivity, it indicates that there could be blockages. But the best way to know whether there is some blockages is to do a coronary angiography. Coronary angiography is a procedure where a catheter is introduced either through the wrist or through the femoral artery that is in the groin, and we see whether there are any blockages in the heart by giving some dyes into the heart arteries. It is basically a 10 or 15 minutes procedure, relatively painless and devoid of any major risk factors. So if there are blockages, then definitely we need to treat these blockages. Sometimes the blockages are not big, severe enough, where medical management or just medicines will be sufficient. But in the patients having blockages which is normally more than 70%, then the option for the patient remains that either he has to undergo coronary angioplasty or coronary artery bypass surgery, or commonly called as open heart surgery. I am a cardiologist, so I will be speaking more on coronary angioplasty. So this is a procedure where we repair the blockages within the arteries. So when there is a blockage which is complete or partially obstructing the flow to the heart muscles, the patient will experience angina or patient is vulnerable to develop heart attacks in the future. So opening these arteries with a balloon support and putting a stents will prevent all these complications in the future. So if your patient is having one or two blocks, then coronary angioplasty in the present scenario is one of the best treatment for these patients. Then if the patients have multiple blockages, then I hope that many of these patients may require a coronary artery bypass surgery. How does we do an angioplasty? It is the same procedure where we do angiogram either through the wrist or through the groin, and we pass a catheter into the heart arteries, put some dye, see the blockages, dilate that blockages with balloons and put some stents. The timing of this procedure may be 1.5 hours, and most of the patients we do without any anesthesia. The patient will be done only under local anesthesia. The patient is again within a couple of days is completely fit and he can resume all his activities within 1 week. So this is how we treat with angioplasty. So what is the risk factors for this angioplasty? If done in carefully selected patients with an experienced cardiologist, the risk is perhaps less than 1%. When we say the risk, it is a death risk is less than 1%. So it is absolutely safe in doing angioplasty wherever is required. Some patients, because of the heart arteries are very bad, they cannot undergo angioplasty. We subject these patients to coronary artery bypass surgery. Then again, whether to do an angioplasty or a bypass surgery, it is basically depending upon the cardiologist and the cardiac surgeon. Sometimes in sync with each other, they decide whether what will be the best treatment for these patients of coronary artery disease. And after the procedure, patient does very well. My own experience with coronary angioplasty, I've been doing for last 20 years. So all these patients are doing very well. Many of them may require after 8 to 10 years of repeat procedures, but then again the repeat procedure is also similarly safe. So this is basically a small nutshell of how a coronary angioplasty and blockages happens in the patients of heart disease. Thank you.
అద్భుతమైన ఆరోగ్య వీడియోల కోసం 3TV హెల్త్ ఛానల్ ని లైక్ చేయండి, కామెంట్ చేయండి, సబ్స్క్రైబ్ చేయండి, అలాగే షేర్ చేయండి. థాంక్యూ.